Hi, everybody. Thank you for having us. My name is Dave Aizer. I'm the TV host for the CW here in South Florida, and I am a cancer survivor.
Hello, everyone. My name is TJ Sharpe. I'm a writer, a speaker. I'm a patient advisor, as Marilyn mentioned, and I am also a cancer survivor.
Back in 2015, I was diagnosed with stage 3 melanoma.
That one's pretty tough, Dave, but I may have you beat. A few years before that, I was diagnosed with stage 4 melanoma.
Always one-upping me. Never ends with this guy. So you take my stage 3, TJ's stage 4, we put them together, and that makes us stage 7 survivors.
As many of you probably know, melanoma is a very aggressive and deadly cancer.
And we were in the late stages of it, so we were in a lot of trouble. But spoiler alert, we lived. It wasn't easy. We have both been through a whole lot, physically, emotionally, and mentally, but we have shared our stories, and we've put together what we call the 7 stages from struggle to strength. And it's a story that we think is applicable to anybody going through any crisis, and we're going to share it with you today.
Hopefully, you'll laugh a little bit, you may cry a little bit, but most of all, you'll leave here inspired and determined.
And if not, there's a pretty cool pool with some drinks, so you can't lose, right? So anyway, like all epic sagas, let's go all the way back to the beginning, stage 1, BC.
My before cancer actually starts with cancer. I know it kind of sounds jumbo shrimpish, but my diagnosis when I was 25 was a stage 1 melanoma, which I didn't understand what melanoma was at the time. I got a call from my dermatologist saying, hey, that mole that was on your shoulder, you need to go to NYU Medical Center and not believe everything you read on the internet about melanoma. So when I got home and got done Googling melanoma, I realized that I had just become a young adult cancer patient. We had surgery, as you can see right there, and I did everything that a melanoma patient should do. I wore floppy hats, long sleeve shirts. I stayed out of the sun, wore a lot of sunscreen, and then I moved to Florida.
Which is not what most melanoma patients would do.
But that's where I met Jen. So I think it was a good decision. We got married in 2008, right over here in Fort Lauderdale. 2 years later, little Josie was born. And 2 years after that, we had our first son, Tommy. And here's us. 2012, I'm sorry. It's a very happy, healthy family. Or at least we thought.
As for me, I don't have any adorable kid pictures to show you, didn't have a beautiful wife picture to show you, but my career was the thing for me. And in the early 2000s, I was a game show host on Nickelodeon. Hosted a show called Slime Time Live. Have you seen it? Okay, cool, very cool. Thank you. It was a great show. It was a big hit, and I got to do a lot of really cool things. I was in the Guinness Book of World Records for sliming the most people. Just a really awesome start to my career, and I had a really beautiful relationship at Nickelodeon for many years. Then I moved to New York, to Los Angeles, excuse me. I moved to Hollywood, started doing some of that really cool LA stuff. I even got to work on American Idol for a little while. Then New York, and continued to work in television, had my own sports comedy web show. I was dating, but I was in no real rush to have a wife or kids because I thought I was invincible and I was going to live forever. And then, a few years after that, I got the dream job. I got to move back to South Florida where I grew up, to be around my family, to be the host for the CW's morning show. And it was so fun. It was 4 hours of live TV every day. I was interviewing celebrities. I got to meet almost anybody I ever wanted to meet, interviewing Nick Cannon and Phil Collins, who was a huge, I loved Phil Collins' music. I mean, it was, every day was that for me. I got to do just really great stuff. And then, 2014, I was on the Love Boat cruise. It was a reenactment of a lot of great 70s and 80s shows, and the heartthrob Adrian Zemed, some of you might remember, I was interviewing him, but as you can see, I had a visitor, I had a friend on the side of my face there, a little tiny brand new mole that meant nothing to me at the time, but little did I know that thing almost killed me.
So let's get to the diagnosis, our stage 2.
The bad news.
Yeah. Maybe before that, we should take a step back. I think this audience has a good idea what melanoma is, but let's put in context how serious it was. Now, any cancer is serious. But the first few stages of melanoma, if caught early and treated and removed, you have a pretty good chance of living a normal life. However, as you get to stage 3 and it spreads to your lymph nodes, or stage 4, where it begins to metastasize to distant organs, you start getting into a lot of trouble.
So back to my trip aboard the Love Boat and that mole. Now, I'd had that mole for about 6 months, and about 5 months prior to that picture, I had gone to see my dermatologist as part of my annual visit. But that day, I didn't see the doctor. I saw the physician assistant, and she looked at that mole and said it was nothing, said it was cosmetic, not to worry about it, so I didn't worry about it. But about 5 months later, I had been able to tell that it was changing a little bit. It felt bigger, it felt kind of uneven. There were a couple of times where I woke up and there was blood on my pillow, and I didn't know it was from the mole, but it was kind of in the same spot. So I definitely noticed. My ex-girlfriend's dog even noticed. People were noticing. So I decided to do something about it. Now, I think this is a good time for me to mention that I can be a bit of a hypochondriac.
He is a raging hypochondriac.
Raging, is that necessary?
You get worried about my scans.
Someone has to. You know, I'm worried about this guy. So, okay, fine. A raging hypochondriac, if you will, and that will come up again later. But in this particular case, being a raging hypochondriac probably saved my life because I needed another opinion. So I went to a different dermatologist. I walked in and he pretty much said, "Hi, nice to meet you. Tell me about that thing on your face." He was concerned. He biopsied it. Sure enough, melanoma. So now, all of a sudden, I have skin cancer, and I didn't know too much about it, but what I knew wasn't real good, so clearly I was scared. So I went to a head and neck cancer surgeon, and he explained to me how aggressive it is, but also told me that they caught it pretty early. It was less than a millimeter. Chances are I was going to be fine, but yes, I was going to need surgery to take it out, to get clear margins, and he also wanted to be aggressive and take out some lymph nodes. He didn't have to because it was less than a millimeter, but he wanted to take out some lymph nodes. So I go in. All of a sudden, I'm in the operating room getting surgery. How did this happen? Surgery was about 7 hours. They did all the things I just mentioned, and there was even some plastic surgery to put my face back together so I could be on TV again once this minor little scare was over with. So I have my surgery, I go home, and even though I'm apparently a raging hypochondriac, I felt pretty confident. I wasn't really that worried about it because my doctors told me not to be that worried about it. Maybe I went on WebMD a couple of times, but all in all, I felt like, okay, let me just get the results, let me heal. This will be a scare and a wake-up call, and that'll be that. Sure enough, my doctor calls me 2 weeks later. I have great news. I have the preliminary pathology. Everything is fine. No spread, no cancer, looks great. I don't have the final pathology, but based on what I'm seeing here, I am 99% sure you are fine. Awesome, I'll take it. Hung up the phone, said a little prayer, told my parents, went for a run, dodged a bullet. Went to sleep, woke up the next day, went to work, and he called me back. And he said,
Mr. Aizer.
Which was a bad sign because my last name is pronounced Aizer. So the conversation wasn't getting off to a good start, but okay, fine, whatever. Yes, this is me.
Are you driving?
No, I'm not driving.
Are you sitting down?
And that's when I knew I was in for a bad news phone call. No one ever says, sit down, I've got great news, right? It's not, sit down, you won Powerball. I knew that it was bad. So I went into my office, closed the door, and he explained to me that unfortunately, with the final report, 3 of my 8 lymph nodes had cancer. So I was now a full-fledged cancer patient, and the cancer was spreading in my neck. So I had to come in to see him, and he told me to bring my parents. So the next day, I went into his office, and he sat me down, and he told me everything. I was stage 3. I was going to need a massive second surgery. They were going to remove a whole bunch of lymph nodes from my neck, the parotid gland from the side of my face, and then there was going to be a massive plastic surgery to put me back together so I could maybe one day be on TV again if I didn't die from cancer first. 24 hours ago, I was fine. Now I've got stage 3 cancer. It was the first time I had ever faced my own mortality.
I, on the other hand, thought I was nice, happy, and healthy with this beautiful little family walking out of Broward General Hospital about 5 miles down the road here. We went home, and I eventually went back to work. 4 weeks had passed, and I started feeling a little sick. And I figured, hey, I'm just tired. I have a 2-year-old and a 4-week-old at home. This is what happens to be a new dad. Some of you dads know what that feeling's like. But then things started getting a little worse. And I called my aunt, who's a nurse, and she said, just go to the ER and make sure everything's fine. Walked into the ER, said, I have this fever that keeps spiking. I threw up once. Tell me what's wrong. Just get me back home to my family. The nurse took a look at me and said, you don't look like someone just got a flu. Let's get you in for some more tests. Had an x-ray done and sat down in the ER, and the doctor came and saw me and said, with your history of melanoma and these spots on your lungs, I'm afraid you have a recurrence of your cancer. Wait, doc. I'm just tired from the 2 little kids I have at home. You must have the other guy's chart, and you switched it with mine. And said, no, I want to admit you. So he admits me to the same hospital we left 4 weeks earlier with little baby Tommy. Get tests done, and realize that the same melanoma I had 12 years prior had come back. And it come back pretty bad. There were tumors in both my lungs, my liver, and my spleen, and an 8-centimeter ball of cancer sitting right on my small bowel. He had decided to have surgery right there. And I was in this hospital for 2.5 weeks. Couldn't even eat for almost 2 weeks of the 16 days I was there. About the only thing I could do was Google melanoma again. And I realized at this point, now I'm a stage 4 melanoma patient. And all those good odds we talked about earlier, they shrank. Because someone with my diagnosis had a median lifespan of about 18 months, and that 9 out of 10 people will be dead in less than 5 years. The internet just told me I wouldn't see my son go to kindergarten. We left that hospital after those 16 days. Jen and I went to see the oncologist. I knew how bad it was. Now, Jen, who had spent the last 2.5 weeks with a husband in the cancer center, a 2-year-old and a 4-week-old, and her in-laws down from New Jersey, she didn't have the time or maybe the patience to Google and understand how bad this really was. So she asked the doctor, what are we looking at? He very bluntly told her, I'll be surprised if your husband's here in 2 years. Now, I knew at that point how bad this was, but I'd also done all that Googling and knew that immunotherapies were at the sort of forefront of cancer research. They were just making this breakthrough. So I realized that I was walking out of there with more than just this prognosis. I was determined to make sure that this diagnosis wasn't going to be what was going to happen for me. I was going to do everything I could to give myself the best chance of getting an durable response.
Which takes us to stage 3, which is determination. We had both been handed some really tough news, but both of us in our own ways found the determination to press forward.
When I left there, I had done all that research on immunotherapy, and I knew that the standard of care chemotherapy that doctor offered me was likely going to give me 2 years, 3 years maybe, if I was really lucky, 5 years. That wasn't enough. So we went on 4 different second opinions before I finally found a doctor who was willing to offer me a clinical trial for immunotherapy. Went all the way over to Moffitt Cancer Center in Tampa, this really amazing oncologist. And he said, I have 2 options for you. First is these new anti-PD-1 drugs that were just in very early phase 1 trial. Or option B, there's this combination of immunotherapies that involve something called TIL, tumor-infiltrating lymphocytes, where we'll take a tumor out of your lung, and we'll find the T cells that best attack your cancer, and then we'll put those back in you. Let them go to town. Right. That sounds like pretty cool. That's kind of futuristic Star Trek type medicine. Let's give that a shot. By the way, doc, how have other patients done on this before? And he said, as far as we know, you'll be the first person to try it in this order.
And when you heard that, how'd you feel?
The way I looked at it, I don't think anyone's ever failed this before. Let's give it a shot.
Love that about this guy. For me, now that I'd been told I needed a second surgery, I spent the month leading up to that surgery getting a brain MRI and a PET scan and freaking the F out, pretty much. It was so surreal to me. I mean, how could this possibly be? A tiny little mole that they told me wasn't going to even be a thing, and now all of a sudden I'm in this tube getting a PET scan and a brain MRI. And they were both negative. People joke that that just means there's nothing in my brain. I've heard that joke plenty of times. But it didn't change the fact that it was terrifying, and it also didn't change the fact that I still might have cancer spreading. Just maybe it was too small at that point for it to be detected in a PET scan. So it was time for that surgery. And that surgery took 14 and a half hours. They removed over 60 lymph nodes from my neck. They took out the parotid gland from the side of my face. Then a plastic surgeon came in halfway through, ripped my stomach up to find some fat and tissue to put it all back together. And when I woke up 14 and a half hours later, I had 3 thoughts. I had gone into the hospital with a pretty bad stomach virus, so my first thought was, did I have an accident on the table? My second thought was, probably more importantly, did they find more cancer? Did they see anything, and they know already that things are bad? And then my third thought was, for all of my friends and family who'd been there for 14 and a half hours, did the hospital validate parking? So, to answer those questions, the bathroom thing I didn't ask. I just didn't want to know, really, ultimately. I still don't. The cancer question, I was told it was going to be about 2 weeks before anybody knew anything. And the third thing, yes, in fact, they did validate parking, which was fantastic news. But all kidding aside, I mean, this was a really, really tough time for me. I was in a ton of pain. I had a drain hanging out of my head. And I felt awful. I felt really, really sick and scared and alone and just all of these terrible things. But 2 things happened to me as I was leaving that hospital that gave me that determination. And since I don't have pictures of those, I'm just going to go ahead and use the body double that I always use, Rocky Balboa. My Rocky moments that I had, I call them. So as I was leaving the hospital, as the orderly was wheeling me out, some guy looked at me and gave me a look I had never seen before in my whole life. And it was somewhere between concern and pity. And I looked at him and I said, yeah, but you should see the other guy. And he laughed and he said, good for you. And that made me feel awesome. And then as I was leaving the hospital, the orderly wheeled me to the door and he said to me, how do you want to leave? And I knew what he meant. And I said, I want to leave on my own 2 feet. And I stood up, which really hurt, and I walked out that door. So even though I was bruised and battered like Rocky, I was in the fight. You know, as I'm thinking about this, he actually lost this fight. Maybe this isn't a good slide for us going forward, actually. We might have to use Rocky too, going forward.
All right, so anyways, that brings us to goals. We both set goals.
Right, we did. And we didn't know each other at the time, but when we got to know each other and talked about our stories, it turns out our goals were pretty much aligned. And the first goal was, for both of us, we knew we had to commit to physically getting healthy going forward.
The second goal was our family. Family was important for both of us, and we wanted to be there for our families.
The third one for us was advocacy. Even at this point in both of our journeys, we both knew that we wanted to be advocates forever.
And the final goal was we both wanted to go to Disney World.
Not true. Did not want to go to Disney. Not true. He did. I had worked for Disney. I had been there 1,000 times. I wanted to see the world, and I don't mean Epcot either, but we both wanted to travel. But in order for all of that to happen, we had to own our situations. So, I find this amazing clinical trial. I'm going to be the first person ever to do a series of immunotherapies. The problem is we need to move our family from Fort Lauderdale over to the Tampa area. So we get in the car during the holidays, Tommy's first Thanksgiving, and we're going to move over by my brother-in-law in the Clearwater Beach area, and we're going to go to Moffett, and this is going to be amazing, and I'm going to turn the world on its head. This is going to be this amazing trial, and TJ Sharpe's going to be the patient number 1. And we're all ready to go, except the contract for the clinical trial wasn't signed. My oncologist assured me it was only going to be a temporarily dot I's, cross T's thing. So we waited. We were over there waiting for a week, for 2 weeks, for 4 weeks. And finally I called him and said, what is going on? You know, I'm in month 3 of this 24-month death sentence, and we haven't started treatment yet. He said, I'm sorry, Mr. Sharpe.
I can't do anything about it. It's out of my hands. We have 2 sponsors, an IRB. We have our lawyers have to approve it. So anytime you get 5 lawyers together, things take a little while. I said, okay, thanks. Let me call you back. So I went on LinkedIn, found a few friends that worked at the 2 sponsor companies. I said, can you get to your legal department and figure out what the heck's going on? And then I decided, being the New Jersey native that I am, that wasn't good enough. So I was going to call one of the pharma companies. I picked up the phone, and I dialed the 1-800 number, and a young lady said,
Hello, Big Pharma.
yes, hi. I'm a cancer patient, and I have a concern about one of your clinical trial drugs.
Please hold.
Well, that sentence right there is the best way to get to the legal department of any pharma company in the world. And I reached the receptionist, who was really nice and really sympathetic and really unhelpful. Her words were, I'm sorry, Mr. Sharpe, the document's not processed. I said, wait a minute. You mean to tell me the best chance I have of watching this little boy go to college or walking this little girl down the aisle is gone because a piece of paper on some lawyer's desk isn't signed? I don't know what to tell you. I said, okay. I'm not going to let this chance go by. And then I gave her a few other choice words of what I thought about document management, if you've seen the movie Office Space. A couple days later, my oncologist called. He said, I don't know what you did, but we just got a call from the sponsor companies. We're starting the trial on Monday. Now, in the clinical trial world, as many of you may know, the contracting process can be a little difficult. The average contract takes about 13 weeks to execute. It's 3 months. In that time, 150,000 cancer patients die. And if you take the top 6 disease killers just in America alone, it's over 400,000 people in the time it takes to sign a piece of paper.
So while TJ was dealing with his ability to take ownership of his situation, I was trying as well, but I wasn't doing great. You know, I had that Rocky Balboa thing when I left the hospital, but the longer I was on my parents' couch healing, the worse it was getting for me. I mean, I tried everything I could think of. I prayed. I went for walks around the house, which was all the cardio I could do. I even meditated, which for me is impossible because I can't stop talking for 2 minutes. But I tried all of it, but I was getting worse. I mean, I had developed legitimate PTSD from those surgeries, and I was having nightmares of getting cut open. And then I would wake up, and then I would think about death all the time. And of course, raging hypochondriac that I am, I was on WebMD constantly, and I was almost like looking for bad news about melanoma. And then I was thinking about my family, my niece and my nephew, and I was thinking about dying in front of them. You know, like when I thought about dying, it wasn't even about me dying, it was about how it would affect other people. And I thought about those 2 kids who I love more than anything, and them watching me die and what it would look like and what it would smell like, and that would be their memory of me as they grew up, and I was so scared of that. And then I thought about my parents, and I thought about my parents having to bury their son and what that would be like, and no parent should ever have to do that. And I was falling apart, you know, and of course I'm waiting every day for the phone to ring to get these results, and I'm Googling melanoma, and I'm just like spiraling. So then, one day, about 2 weeks later, my mom was driving me to see some family, and my phone rang, and it was the oncology department where I had my surgery. And it was just them reminding me that I had to come in for an appointment. And I said to the nurse, I said, you know, while I have you on the phone, any chance you have my results? And she said, let me check. And I immediately regretted asking because I didn't want to know. And then she said yes, and then I regretted it even more. And then she said, hang on. And I just sat there in the silence, and I heard her typing away. And I'm like, oh my God, she's reading the results right now. I'm about to find out. Or she's going to tell me the doctor has to call me, and then I just might as well drive off the road because it's over. But she got back on the phone, and she said, Mr. Aizer, which was good because that's how you pronounce it. She said, I have your results, and normally I would let the doctor tell you, but let me just go ahead and tell you, everything is negative. And those 3 words were like the greatest 3 words I've ever heard in my entire life. I mean, I still think about that when I have tough days. everything is negative. But I didn't believe her because I already had a phone call that I thought was good and turned out to be bad. So I was like, are you sure? And she just read to me over the phone, lymph nodes 1 through 5, negative for melanoma. Lymph nodes 6 through 10, negative for melanoma. And she just kept going until she ran out of lymph nodes. And I was crying, and I looked at my mom, and my mom was crying as she's driving down I-95, which is a bad idea. But we were both sharing this wonderful moment. I mean, it was incredible. Still, thinking about it, talking about it right now brings me right back to that place. But it wasn't over. As we have been talking about, melanoma comes back. We know that. And I had read enough to tell me that it could come back. So I had to start thinking about next steps. And while I started meeting with different oncologists and looking at different treatment plans, I did one very important thing to take ownership of my situation. I had been back on television, but I didn't look great. My face was really swollen. I had a beard actually on TV for a little while, but people were calling in and asking why I looked different. And I just decided I'm going to get out in front of this. And I went on TV and I told everyone in the South Florida community about stage 3 melanoma, and that they need to go to their dermatologist, and that they need to wear sunscreen, and this is why I look like this, and I'm still in this battle, and who knows how it's going to turn out. And doing that was so incredibly liberating for me, and I still do it today on TV whenever I can. And as I was doing that, as I mentioned, I started talking about treatment. And for my stage 3A, I had 3 options. One option was to do nothing in terms of drugs or vaccinations or anything like that, was just to be monitored. Just to go to the oncologist and just to have them check up on me. That was one option. Option 2 was something called interferon. I don't know if you guys know what that is, but I had done my research, and it's really beats you up, and it doesn't really do much to improve your survival rates. And then number 3 was a clinical trial. This particular trial was 75% active, 25% placebo. It also meant a hypochondriac was going to be subjecting himself to constant doctor visits and needles and blood work and waiting for that blood work to come back and being monitored all the time and being around people who were sicker than me, which is a really hard thing for me to do, or it was a really hard thing for me to do. But I did it because I couldn't do nothing. I could not sit there and do nothing. I had to take ownership however I could do it, whatever it meant. It wasn't a question of why me anymore. It was me. It was now. It was here. And yeah, I got good news, but I didn't want this thing to come back. So I signed up for that clinical trial, and it was a great decision for me.
As you know, cancer is a journey filled with ups and downs. And we were both about to get tested in crisis mode. I moved my family over to the Tampa area. And here we are in the Gulf Coast, ready to take on this trial as a family. The first thing we did was have a dose of immunotherapy, and following that, they removed my lower left lung, took out the tumor, got the T cells ready. They're gonna make this amazing T cell treatment. And we're about to do it. We're ready to go in. They put me through an x-ray right before Thanksgiving, just to make sure everything's okay. We're gonna do this right after Thanksgiving. And they find a diverticulitis. I said, all right, well, you have 2 choices here. We're about to lymphodeplete you. We're gonna knock your entire immune system out. So either you come off the trial and we fix this diverticulitis, or you get a colostomy bag. I said, if the colostomy bag means I can still stay on the trial? I said, yeah. All right, let's go for the colostomy bag.
Which felt?
Shitty. The week after Thanksgiving, I got the colostomy bag, which I had for 2.5 years. We pushed off the start of the trial until just after Christmas, when the T cells were ready. If you ever have seen 60 billion T cells, they look just like that. And we are ready to go. January comes around, and we infuse the T cells in me, and then they give me something that's called high-dose interleukin-2. It's also another immunotherapy, and it's really difficult on your body. The first one was fine. The second one, you start to feel it. By the 7th one, I was ready to tap out. And none of it worked. At the end of February of 2013, I'd lost 50 pounds, and I'd failed the clinical trial. But I refused to give up hope.
And whereas TJ was physically going through hell, I was mentally and emotionally there. I didn't have any of that stuff. I was fine. My scans were fine. My blood work was fine. I should have been on top of the world. But what happened to me personally was I never addressed the mental health part of having cancer. You know, when I went into this cancer experience, I knew that physically it was going to be painful and the scars and the surgeries, but I never really spent any energy thinking about what it was going to do to me emotionally. And it did a number on me. And I didn't go to therapy, and I always tell people that I really think that they should, because I was so scared all the time. And it was weird because every time I would get good news from a scan, I actually felt worse. You know, it was almost like, okay, fine, that's good news, but tomorrow's the day it's going to come back. So it's a cruel joke to give cancer to a hypochondriac, because I constantly thought I was dying of everything. One day, I just like harmlessly rubbed my forehead and I felt a cyst. And to the normal human being and to the 10 doctors I asked, it was a cyst. To me, it was obviously bone cancer. I got a sty on my eye from all of the anxiety over all of this. I asked my ophthalmologist what it was, and he said, it's a sty on your eye from all of the worrying. And I said, no, it isn't. It's ocular melanoma. Trust me, I Googled it. And then the worst part was, I was on vacation, sleeping, woke up in the middle of the night, I smelled smoke. So I went outside. I didn't see a fire. I didn't see any smoke. I'm smelling around for smoke. I can't find anything. So logically, imaginary smoke smell, brain tumor. Turns out it was a fire that happened to be dangerously close to the hotel. We were all in a lot of trouble, but we did live. So, you know, I was like absolutely just in my own head, terrified all the time, and so mean to myself. I mean, I was dealing with all of these different emotions. There was the anger, and then the self-loathing, which to me was the worst part of it, the anxiety and the fear. I was so mad at myself every single day because listen to what TJ was going through. I wasn't going through any of that stuff. I should have been fine. Okay, fine, it might come back, but I could also get hit by a truck tomorrow. Who knows? But I just couldn't get past the fact that every time anything hurt on me, this is it. This is the cancer. This is it, liver cancer. Oh my God, stomach ache. I mean, I was living like that all the time. I couldn't even get out of bed. I had definitely hit rock bottom. This was rock bottom for me. But I was about to get a major assist from above.
As you see, the journey through cancer is both a physical, mental one. And you need resilience of the mind and the body. Let's see how that happened.
So I get a phone call from Gilda's Club, which is a local cancer charity here in South Florida, and they asked me if I would come rappel down a 30-story building in Fort Lauderdale and to put it on TV. And at first I was like, yeah, it sounds kind of terrifying, but I had already been skydiving, so okay, fine, I'll do it. I thought good karma, it's a cancer charity, and I thought also, you know what, this is my way of getting some control back, right? I was letting cancer beat me down. I wanted to get some control back. So I did it. I went for it. And it was really fun. I don't know if you guys have ever done it, but it's awesome. You know, you're just going down and it's just really cool and you feel strong and you feel powerful and you feel confident. And I stopped halfway through just to, I don't know, congratulate myself. But what they didn't really tell me is that if you stop doing this, you get stuck. So I got stuck about halfway down the building and I freaked out again. How can this keep happening to me? I'm dealing with cancer. I think I'm going to die all the time. I finally am feeling good about life, and now I'm stuck halfway down a building. And they're screaming at me what to do, but I can't hear anything. It's just a lot of this stuff, and I'm trying, and it's not working. And then I start thinking about how am I ever going to get down? So then I start thinking, I know how. Someone's going to call the fire department, and a fire truck's going to come. And a fireman's going to get on his ladder and he's going to climb up and he's going to be shirtless for some reason. I don't know why, but I just think he will be. And he's going to carry me like a baby in his arms to safety. And it's going to be on TV and it's going to be on YouTube and it's going to be humiliating and it's going to be the worst day of my life. I thought all of these things. And in the midst of this like panic attack halfway down the 110 tower, I stopped and I laughed at myself. And then I looked up and I thought, you know what? Maybe this is a sign. Maybe God is doing this on purpose so I can just take 1 minute and appreciate how beautiful the world is and how lucky I am to be a part of it. And I felt figuratively and literally close to God in that moment. And I just got really happy. And ultimately, I made my way down. And I was never a miracle guy, but to me, this was a miracle. And when I got down on the ground, shortly thereafter, I resolved that that was it, no more. I'm going to go to therapy. I'm going to figure this out, and I am going to start living fully as best as I can every day, and that is what I did.
Meanwhile, my health was what was free falling. We had failed a trial, lost 50 pounds. We're looking for a plan B. And I asked my oncologist, well, we had two options before, right? We had this anti-PD-1 drug. Let's get started on that. And he said, yeah, let's get started on that. Hopefully when you're done your washout period, we can get you on this trial. And that all sounded great except for the hopefully part. And I said, what, did I get excluded from something? Is there a colostomy bag messing this up? And he said, no, it's just that the one trial I want to get you on doesn't have a signed contract yet. I said, oh. And I had my moment then too, like Dave did. Josie was about to turn 3, St. Patrick's weekend, this weekend. And we had this big party for her. And halfway through the party, I had to leave and walk back to our house. I threw up, and I laid down and sort of passed out on the bed. And I woke up an hour and a half later, and maybe I had a sign too. I woke up and I looked, and I don't believe in some of this stuff, but all of a sudden, it was 3/17 on March 17th. And I had that thought that someone's trying to tell me something too. And I realized that some days cancer does win, and that's okay. But I have tomorrow, and I was going to resolve to do everything I could the next day and the day after that to not let cancer win that day. Ironically, a couple days after this party, a woman named Catherine Poole, who runs a melanoma organization and is a long-time melanoma survivor and advocate, she called me. And she said, I had this great melanoma walk. We'd love for you to be a part of it. By the way, how'd you do on your trial? I said, well, not so good. I lost those 50 pounds, which is about 10 pounds of baby weight and 40 pounds of not baby weight. And we're looking for plan B, but now I'm in contract roulette with Big Pharma for the second time in 5 months. She said, let me call you back. And 4 hours later, instead of 4 weeks later, she called me. There's a clinical trial with another PD-1 drug, just like the one you want to be on, that's a few miles from your house in Fort Lauderdale, instead of a few hours away. Are you interested? And I said, yeah, well, did they have a contract signed? She said, yeah. Yeah, I'm interested. Let's take a look. So we made a very difficult decision to leave this great place and a wonderful team at Moffitt and come back here to Fort Lauderdale, a really small cancer center. They didn't even have a melanoma specialist, but they had the trial that I thought was going to save my life. So here's me on the second ever trial for what's now known as Keytruda. You may have heard of it. Getting my first dose in April of 2013. And here's me 4.5 years later, getting my 75th and hopefully final dose, which, as far as I know, is the most or among the most that any one person has gotten on trial. Maybe I'll end up in the Guinness Book of World Records with Dave.
I know a guy. I'll make a call.
And the reason I stopped the medicine is because we got this in the summer of 2017, a scan report that said malignant disease is not suspected on the basis of this examination. For the first time in almost 5 years, someone told me I didn't have cancer.
So TJ and I, we're both cancer-free. We remain cancer-free today. We know that we're incredibly lucky, and we've learned a lot. One of the things that we've learned is perspective. We're completely different now. We're so much more aware of the world around us and what really matters.
We talk about what's really important to us. We talk about the goals that we had talked about earlier, we set earlier.
Right.
We found that.
So healthy. We both are as fit as as we can be. Maybe I could be a little fitter, I don't know. But we both really, we've taken our health very seriously.
We've connected again with our family and made those the priorities in our life.
We both embraced advocacy. TJ speaks all the time. He'll tell you more about that, and I'm doing whatever I can on TV and on stage and in the community to make a difference.
And we're both going to Disney World.
No, we're not. Still not going to Disney. Still not going to Disney, but traveling a lot.
So we're going to leave you with a couple quick stories about these and how these have really affected our lives and changed our perspective on what it's like to be a cancer survivor. For me, when I was first hospitalized, my best friend said, we're going to do a Tough Mudder. And you guys have heard what this is. It's like a 10, 12-mile run through the mud, and you get a headband and a beer at the end. And I said, that's a really audacious goal because I'm sitting here with an NG tube down my throat right now. But we did it. A little over 2 years after my diagnosis, we went climbing monkey bars with, you could see a colostomy bag showing. And
just confirming that's mud though, right?
Yeah, I'm sure it is. We set that goal, my best friend and I. I had a goal when I was a kid. My dad was really big into setting goals, and he said, write them down. And I actually found that piece of paper I had hanging on my bedroom, on my mirror in my bedroom. And in it said, be a triathlete. Now, I thought that meant swimming from like one island in Hawaii to another. Didn't quite work out that way, but 3 years ago this weekend, St. Patrick's Day weekend, 3 years ago, I finished a triathlon right in Fort Lauderdale. And the best part wasn't getting the medal, wasn't even checking off the box that I did it. The best part is that guy in the white shirt right there. That's the ER doctor who admitted me. He's become a friend and a mentor. And very recently, has also become a cancer patient who calls me for advice on how to deal with his diagnosis.
For me, it's tennis. Tennis was my favorite thing to do for most of my life. And then when I got sick and I got rid of all those lymph nodes, or they got rid of them for me, there was a chance I wasn't going to be able to lift my arm and my tennis career was going to be over. And I, believe it or not, of all the things I was really worried about, that was one that I was worried about the most. So now, every time I set foot on the tennis court, I'm just so grateful to be able to be out there playing. And as you can see, that is about as much sun protection as one human being can have. I don't know if the sun could actually get to me, even if it wanted to. But I've been doing that as much as I can, and I've done my fair share of 5Ks, the Dolphins Cancer Challenge, which is a huge event down here. And actually, for that event, I represented the hospital that saved my life, the Sylvester Cancer Challenge. I was a member of their team. They even took a giant picture of me and put it on the wall in the hospital. I was wall art. But that was really great. You know, in that event, the DCC, you get to spend time with other cancer survivors, and it's an incredible feeling of community. So I'm blessed to do that as much as I can. I speak whenever I can to American Cancer Society events. My TV career has been awesome. I'm so grateful that I'm able to be on TV again. My plastic surgeon was wonderful. Not only do I get to interview Marky Mark and the Fresh Prince, but I get to interview real stars, real celebrities. I got to interview the doctor who saved my life, that guy right there. And I put him on TV and I thanked him. And that was, forget all the Will Smith interviews you could ever do. That was one of the best interviews I've ever done in my whole career on TV. I've also written a book. It's called The Hypochondriacs Guide to Beating Cancer. And it is autobiographical and largely self-deprecating.
You should read it. He's crazy.
Thank you. Thank you very much.
Tell him about the time where you had your foot was asleep and you had a spinal tumor.
Yes, yes. Went to the movies, foot fell asleep, left the movie because I was sure I had a spinal tumor. That's in there. Yeah, you'll enjoy that one. But I wrote it because I wanted people to know it's okay to be scared, and that doesn't make you weak. I went through so much of that. I beat myself up so much, but it's all right. You should be scared. It is a scary thing. As long as you fight every day, even on the days that cancer wins, as long as you do something, you take one step forward. And also, if somebody's going through what I went through and TJ went through, and they're really scared, and they think everything is something, maybe they'll know that there's one person in the world crazier than them, and I'm happy to be that person. And this was pretty cool. Got to throw out the first pitch at a Marlins game on Melanoma Awareness Night.
Hey, you know what? I got to do that too. And I almost bounced mine off the backstop.
Yeah, but you got a second shot at it.
I did, with my hometown Phillies. There's me in the windup in the stretch, and this was a faster wild pitch than the one before. Advocacy isn't just about fun and games. Dave mentioned before that we do a lot to try to raise awareness. I still write the blog that I originally started, along with a number of other places. I speak about it in the pharmaceutical and the clinical research world. I work as a patient advisor to a number of pharma companies, and maybe the most important job I have is to represent the patient voice with an organization called Transcelerate. Marilyn mentioned earlier, we are colleagues. Transcelerate, if you're not aware, GSK is one of 19 member companies that is looking to make clinical research better, faster, more effective, safer across non-competitive spaces. And I'm the patient advisor. Think about that. It's really humbling to represent every patient in the entire world to 19 of the biggest pharmaceutical companies in America that are out there trying to make people's lives better. It's a pretty amazing feeling. And there's Disney. Now there's the real Disney, and then what has become Disney. And the real Disney for me was actually going to Disney World that December, right after colostomy surgery, a couple weeks later. We went, and I had the chance to buy the one-day pass and bring our kids. You know, Tommy was a baby. I said, no, you know what? We're gonna get the annual pass. We're not gonna let cancer mess with this family any more than it already has. And we've continued to get the annual pass every single year. And they went from riding the carousel to now going on Space Mountain. Here's Tommy and I on his first ever ride. If you ever took any of your kids, or if you even remember, I remember my dad taking me on Space Mountain when I was in 2nd grade. Anyone could have taken Tommy on a roller coaster. But he'll always remember that his dad was the one that brought him on Space Mountain for the first time. Disney's become that. It's not just the park. It's our lives. It's being a part of my family's life. We went on vacation. We can plan things more than every 3 months between scans. We went to Colorado last year and went whitewater rafting. We took the kids to the Jersey Shore and played skee ball, and I beat them at miniature golf. And for me, it's also become some things that are personal goals. I started coaching high school football at St. Thomas Aquinas, right down the street, where my wife and brother-in-laws went to school. It was something that I always wanted to do. The Tough Mudder crew dragged me to hike up Mount Katahdin in Maine, the northernmost part of the Appalachian Trail. Here's us at the peak. And I do all these things, not just because I want, not just for selfish reasons, but because someone out there is hearing for the first time, you have cancer, or is sitting there in a hospital bed, Googling melanoma, immunotherapy, anti-PD-1, and they're looking for hope. Probably the only goal that I didn't have was to coach 4-year-old soccer. Any of you have done this, you know how hard this is. And I had no desire to do it until one day someone told me I wouldn't be around to be able to. And so every day, every fall, I coached Tommy and Josie's team. And 10 days after I had my colostomy surgery to reverse the colostomy and just be normal again, I went to Tommy's game. And the goalie was out of position. And my assistant coach took over. And I looked, and I'm like, all right, let me go over there and help the goalie. I'm shuffling, and my stomach's still stapled, and I can't get anything in this area right here, or God knows what's going to happen. And I can hear Jen over here going, what are you doing? Get back here. I said, honey, I didn't beat cancer to sit in the sideline.
I still have not been to Disney in the last few years anyway.
We're going.
I'm not.
Yes.
But for me, I go to Fantasyland now every year, which is Cleveland Indians Fantasy Baseball Camp. I've gone 3 years in a row now. I went starting 1 year after I was diagnosed, and I go with 2 of my best friends, and it's my favorite week of the year. Every year, it's a true bucket list thing. I would tell you guys, do all your bucket list stuff now. Just do it, don't wait. I had said no to these guys for a couple of years. It costs a fortune, so it was something I never wanted to do, but now, you know what? Screw it. And I go, and it's a great week every single year, and I love it. And I'm gonna keep doing that. I have been traveling more. I went to Cleveland. My beloved New York Jets were playing the Cleveland Browns, so I went to Cleveland to watch the Jets lose. But that's okay, that's what they do. That's fine. What's that? Good. Hey, we're gonna be good. We just got Le'Veon Bell.
You hear this every year.
I have to be alive for that. Yeah. for the Super Bowl. So I've got to live another 50 years, apparently. So I've been traveling as much as I can, Cleveland, and then I went to Chicago, and I went to Punta Cana in the Dominican Republic. And in about 10 days, I'm going to Hawaii. But I'm not taking this trip by myself.
We're going together?
Nope, we're not going. I'm not going with TJ, as much as I would love to. Let's wait till we speak there.
Okay.
I'm going on my honeymoon because 1 week from tomorrow, I am getting married to that lady right there, who is my best friend and the best thing that has ever happened to me, and that includes beating cancer. And I'm so blessed that I get to live with her, and we're going to start a family, and we're going to see Hawaii. So I'm very excited about that.
As for me, I have my family now too. The little 2-year-old has turned into a sassy, spunky, smart, sometimes attitude-filled 9-year-old, who I would like to thank GSK for having us here today, because I am currently missing 10 third graders getting their hair and their nails done at the salon. I conveniently scheduled that part of the birthday party right around lunchtime today, once Marilyn told me what time we were going on stage. I also have a little baby boy who's now a first grader, who loves sports and laughing and camping and getting dirty and everything else that little boys like to do. I get to watch all this. And I have Jen, who's gone through sort of hell and back with me and had her own ups and downs as a caretaker, which I can't even begin to understand how difficult that is. We've gotten through all this together, not always seeing eye to eye on certain things, but we made it together through. And now we get the opportunity to fight about stupid stuff. And that's a goal I never had, because for the longest time, it seemed so insignificant who was putting the laundry away or who's going to empty the dishwasher. And now we're back to normal.
Can't wait to get married.
Yeah.
Sounds fun. Yeah. Sounds great.
We'd like to leave you, I think, with one sort of final message, that when you go out to the healthcare providers that you service, that are part of the GlaxoSmithKline network, bring this story with you. Bring the goals that we set, the importance of what it is, and help people do more, feel better, live longer. It's a pretty good mission right there.
Definitely. And we also want to leave you with one more bit of advice.
Wear
sunscreen. Yes. But not SPF 10. That's not enough. Okay? 30 and up. Broad spectrum.
For Dave.
And TJ.
Thank you. Thank you, guys. I know it was a lot to sit through the last hour of this conference, but we did say we would take any questions, and I think our HIPAA rights have fairly been waived a long time ago. So
yeah, what do you want to know?
If you want to know anything, by all means, even we're the best place to go for St. Patrick's Day if you're sticking around for the weekend.
Hi, Dave and TJ. Thank you so much for sharing your stories. They're truly inspiring. I just have a question for Dave. Sounds like you entered an adjuvant study trial. Do you mind sharing, or can you share what drug you actually received?
Yeah, sure. So I got my surgeries done at Sylvester Cancer Center, University of Miami, but they didn't have any trials for stage 3A. So I ended up going to Mount Sinai because they had a trial. The drug was called Seviprotamid L. Vaccine, and the company was Melanoma, LLC. And that, for me, at stage 3A was my only option because all of the other drugs were like 3B and up. So that's what I took. It was 2 years. It was injections in my arms and my legs. In the beginning, it was every 2 weeks, and it was 3 months, 6 months, whatever. And it was, like I said, 25% placebo, and then the rest active.
Thank you.
You're welcome.
Thank you again for being here. You're both just amazing, and I don't want to cry, so I'm not going to do too much. But I'm curious, it's so clear to all of us how important support is. How did you guys find each other, and where were you in your journey?
Marlon's Awareness, Melanoma Awareness Night, right?
There was two things. Marlon's Awareness, but that was the first time we met.
Right.
But we were connected through a charity that I'm involved in. It's called A Prom to Remember. And it started here locally. There's two chapters. We actually throw proms for teens that are affected by cancer. So it's coming up in two months. The founder had been on Dave's show, and Brandon said, hey, I met this guy. He's going through this stage 3 melanoma, Joe. He won't shut up about his melanoma diagnosis. And we connected there, and then the melanoma night at the Marlins was the first time we ever...
Yeah, and we hit it off right away. And, it wasn't like, hey, let's speak together. That was never the thing, but we just have so much in common, and our stories are similar but different enough. And, I love this guy. Thank you.
Thank you.
He's just a lot taller than me. I have to work on that part. Yeah, we were taking a picture earlier. I'm like, how tall are you, man? Jeez. I was 6'4" before cancer. That was a weird...
Yeah, it's shrunk.
Side effect.
There's more skin here to cover. At least you have an advantage.
Yeah. Anybody else?
Over there. You just shout it out if you want.
So thank you again. I really appreciate you sharing your story, and just it always gives us perspective. Not that patients are at the heart of what we do, but when we hear it and we see you and we just feel it, really thank you so much. With that said, I was just curious, is there any advice you would give to us? Obviously, I feel like you help drive us. A lot of us have been personally affected by cancer, but what more could we do? The contracting thing is very real, and that's actually kind of in my realm a little bit, so appreciate the honest feedback. But is there anything else that you think we could be doing more or better?
Want to go?
Sure, I could talk about this forever, as Marilyn knows. So, you go first. I'll let you.
Mine for me is as much as you guys can do to just be conscious of the mental part of all of this. I really kind of felt alone on that to some degree, and I was told by friends to go to therapy, but I was like too tough for that, which is ridiculous.
Rocky.
Yeah, so I don't know if there's a way that you can just sort of impress upon people what this journey is like, especially if you're prone to anxiety like I was and sort of still am. I think I would have been really grateful for maybe a mandatory meeting with a counselor or something like that, if that's something that you guys could provide. That would really, just be able to talk about it would be great for me.
And one of the things that I have stressed repeatedly, talking to people in the industry, working with people in the industry, is that it's going to affect all of us. If I asked if someone in here has someone that they love that has been affected by cancer, most of you would raise your hand. And if you haven't raised your hand yet, you're going to. So when you're doing your day-to-day job, it's probably monotonous sometimes. It's probably difficult. You probably miss out on things that you wish you didn't have to miss out on. You're sitting here in a conference room. You'd rather be sitting out there on the beach or going home and seeing your kids and your spouses. But someone, somewhere, is looking for that hope. They want that chance to get on a clinical trial. They want the chance to get a drug approved so that they can get a longer life or a healthier life or a better life. And you're part of that. So do your job, do it well. I'm sure you do it well. But when you do it, think about those two little kids that were up there, that there is a family at the end of this. There are people who want to see their spouse live. They want to see their parents live. And sometimes they want to see their children live. That's an amazing, amazing responsibility that you have. And for all those patients, I think I'll speak for Dave and I and everybody else, thank you for the effort that you already put into your work, because it really means something.
So it sounds like both of you actually kind of got into the mindset of, I'm going to try a clinical trial. How did you know about clinical trials, and how do you help other patients find them, and how can we help them find them? Because so few patients, I think, even know what they are or recognize them as an option.
This is a setup question because we work together on this kind of stuff.
I'll go quickly. For me, when I met with the oncologist, he had mentioned that it was interferon or nothing, right? And there was not a clinical trial. And then I had to do the work myself. Like, I went to cancer.org, and I remember calling someone on the phone and trying to figure out where I could meet. And so a lot of the legwork, and TJ and I have this in common, was us fighting for our own lives. Because nobody came up to me and said, I'm going to put you in a clinical trial. That never happened. And had I been content to just do the interferon or do nothing, I would have just stayed at that one hospital that did the surgeries on me. So I guess the answer to your question is, there really wasn't anyone that sat me down and said, I'm going to help you find a clinical trial, even though it's not at my hospital.
I actually worked in the pharma industry when I was first out of college, so I knew what clinical trials were. They were something that somebody else did. So when medicines get approved, somebody else does a trial to get the medicine approved. And then when you're laid in a hospital bed and you start realizing that there's less than 2 years of life left if you take the medicine that's already approved, you kind of quickly say, all right, I need something else. This isn't enough. I'm fortunate that I had the industry experience. I had friends that understood the medical healthcare world and were part of the pharmaceutical world that helped guide me to find a trial. But I think I'm the exception rather than the rule in a lot of ways, sometimes not good ways. The industry has an issue with trying to get patients enrolled in trials, and patients have issues trying to find their best treatment, which oftentimes can be a clinical trial, at least to consider it. To answer your question in a longer way, there's a lot that the industry can do. And I work with another GSK colleague on a Transliterate project that's trying to bring awareness, that's trying to get better clinical access through clinicaltrials.gov. As you work in the medical field, the best thing I can offer you is to push out to those people that are the first, not the first responders, but the first point of contact, that every time someone gets a serious diagnosis, have the conversation with them quickly. Have you considered a clinical trial? Do you know what's available for you? It might not be available right there, but at least know what all your options are, because then you can make the best decision for your own health care.